Welcome back to Medical Coding with Blue. Today's episode is all about how to find your first job in medical coding in 2022. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, I know that we are in the home stretch of 2022. However, I always center my videos around what I'm getting asked about a lot. And of course, jobs is always a big thing. It is so big that I'm getting this almost every single week now, even though my channel has 53 videos all about advice on how to find your first job. People still ask me. So I'm going to do this video yet again because my advice is going to be the same. When you are out there looking for your first job in medical coding, you want to apply for every place that is looking for a medical coder, regardless if they were asking for experience or not, because this is how new medical coders get in. A lot of times when you get out into the industry, you will see candidate must have 3 to 5 years experience. Everybody wants experience. How am I supposed to get in if everybody wants experience, Blue? Well, the thing that you have to do is arm yourself first and foremost with a very good resume. And by that, I mean that you have your name and you have your credentials first and foremost. I have seen, because I am a resume writer myself, if you're interested in that, my rate is in the description box below. But I have seen a lot of resumes come to me with no credentials on their name. And the credentials that are on their resume is just sort of an afterthought because they put it all the way at the end. And that's not the way that it goes. When you are a brand new certified medical coder, you need to make sure that those credentials are on your name. It's the same thing if you are on LinkedIn. You still need to identify yourself with your credentials at the end of your name, all right? And when you are going through and you're listing all of your experience and things like that, you're writing your resume should be no more than 2 pages. If your resume is 3 or 5 pages, because I've seen them, they're all over LinkedIn. Do not do this, guys, because if you're sending that out as your calling card, those hiring managers are going to pass you over. Why? Because that's just too much information, and there's a good chance that you're repeating yourself a lot, or you're adding in additional things that don't even need to be there. The thing about resumes is this is your calling card. This is the first thing that this employer is going to see of you. And it doesn't matter that you don't have experience yet. You have training. That's what they need. Your objective is to sell it to them, all right? So the thing is, if you do not have all of the staples on your skills list, right? And even though you've never had a job in medical coding before, if you do not have those staples of ICD-10-CM, if that's what you've been trained in, ICD-10-PCS, if you have that training as well, CPT and HCPCS, if you do not have those on your resume, obviously it's going to get rejected. And if you are lazy, if you do the lazy way, do ICD-10 and then nothing else, if I'm a hiring manager, I'm going to pass your resume over too because you're not detailed. That's what a lot of these employers will see, is if you're detailed. And it starts with your resume. So you have to have a very nicely laid out resume. It should be no more than 2 pages, all right? You don't want to go back on your job history any more than 10 or 15 years because that's as far back as the employer will run you. Now, some employers will run back further. However, if that is the case for that particular employer, they will let you know, and then of course you can give them that additional information. This is basically giving them a snapshot of who you are in the present moment and what kind of experience do you have. Now, when you're getting out your skills list, do not follow that stupid template that's running around out there for medical coders where they have NCD, LCD edits and all this Medicare parts A, B, C. And don't copy that, guys. Don't copy that, because if I'm a hiring manager, I know that was copied. All right. So you do need to identify your particular skills. Everybody knows about NCD, LCD edits. Everybody knows about Medicare, Medicaid when they first start. So don't even worry about that. All right. The thing that you need to concentrate on is hitting out those skills that are literally listed in those job listings. And pay attention to the job listings. What are they looking for, right? If you were trained in outpatient medical coding, that's what you need to talk about on your cover letter, all right? Cover letters are also very important. And you don't want to say, oh, I'm looking for a challenging place who will train me. you don't want to highlight the fact that you do not have experience. You don't want to highlight the fact that, this is your first time out there, brand new. You want to highlight what you know. That's what the employer wants to see. Because if I'm a hiring manager and I see I want to work in a place where somebody will train me, next, I'm not even going to, because this says this person needs to be handheld, and I don't want to do that. Because employers will be like that. They will say, well, we want people who have experience. We want somebody to be able to be dropped in because we need help right now in our clinic and we don't have time to train somebody. But if you're telling them, hey, I know ICD-10-CM, ICD-10-PCS, if I have that training, CPT, HCPCS level 2, if I have all of these things, medical terminology, anatomy, pathophysiology, if I have all of this on there, okay, this person has the skills that we need. Let's see if they have the knowledge. And then sometimes you can get lucky enough and get that quiz, their assessment test. So that way they can see, does this person know? And if the employer is desperate enough, oh yeah, they're going to give you that assessment test. Okay, let's see what this person knows. And if you can pass that assessment test, that's another step towards getting you in. All right. So don't be afraid, or don't think that you can't apply just because it says candidate must have 3 to 5 years experience. Okay. So that's something that you need to know. If you are only applying for remote coding positions. Now, yes, the pandemic changed the whole thing about how people are hired. And yes, some people are still able to get into remote. However, it's getting harder because a lot of people are going back to the facilities. So that's something that you have to keep in mind. Before the pandemic happened, you had to have 3 to 5 years experience, hands down, no ifs, ands, or buts, in order to be able to get into working remote. However, because of the pandemic, they said, okay, well, we still need coders. So they were able to hire those people and to get them on, and they were able to be trained and things like that. But it took a lot of work to get those people trained. So now that we are semi back to normal with going back to the facilities, again, it's going to be harder for new people. It's not impossible, but it's going to be harder. So accept that as, okay, that's just part of the deal. Because if you set out to go out and apply for jobs, and that's all you want, and you want to see entry level, and you want to see remote, you're going to be looking for a long time, right? So again, set yourself up for success and apply to all of the jobs that are requiring the skills that you do have, right? So just make sure that you're trying to get out there. Don't try to look for easy places to work. Oh, that this is only diagnosis coding. If you work in a risk adjustment position as your first job in medical coding, yes, while it's good because it's getting you in, you don't want to hang out there too long, folks, okay? Because I have seen on job listings where employers will not take medical coders as having experience if they only have risk adjustment experience or HCC coding experience. If that is the only experience you have, they're saying that's as good as not having any experience, because you are missing out on two fundamental things: procedure coding and E&M coding. So you don't ever want to lose your skill, right? That you know, or that you were just trained in, to be able to be out there, right? So again, if you want to get that HCC position, that's okay, but continue to apply for other positions that are going to give you that experience of, working with E&M or working with procedures, because that is very important, okay? The other thing is, you want to apply with a temp agency. Get yourself enrolled with a temp agency. Now, there are hundreds of thousands of temp agencies out there. Please do not ask me. This is the one and only time I'm going to ask you not to ask me, because all you have to do is Google in your area temporary agencies for medical professionals, and all of the temporary agencies will pop up. If you ask me which one do I recommend, you're going to get blocked, guys, because it's not funny anymore. It's not a joke. It's not funny. It's a waste of my time when I get that question. Now, I get this question a lot, and I don't know why. I'm not everywhere. I don't know every single temp agency. All I know is that when you type in temporary agencies for medical professionals in Google, it will give you all the available places. It's on you to do your due diligence and check them out. So that way you can see, is this place going to work for me? Now, working with a temp agency versus contacting a recruiter. This should be its own episode, all right? So when it comes to working with a temp agency, they are not going to just set you up on one-day assignments, right? With medical coding, they're usually going to set you up like on month-long assignments. Sometimes it's 3 months. When I got my first job with a temp agency, it was for a 3-month assignment. So that's how I know that they don't just call in a temp agency for medical coders for only one day. All right, so you will get a variety of experience. You will be able to meet all kinds of people and everything. And sometimes employers will go through the temp agency just to like check out the candidate first before they go through all this process of hiring them. So sometimes it's like a try before you buy type deal. I hate to say it like that, but that's essentially what you think it is, right? Because you're hired on with the temp agency. The temp agency's responsibility is to get you a job, all right? And so however they test you, because they're going to test you at the temp agency too. I have done that. I took the test and they said, okay, well, you did very well. So we'll give you a call in a week and we'll let you know. And I'm like, oh, whatever. I've heard it before, but they did. And a week later I had a job. I had a 3-month assignment. And that was what led me to my next assignment with a temp agency, which was for even longer, but I was there for like 8 months. And then I came here to my forever home because my forever home was not a part of the temp agency. This was a job that I was applying for. So that's something that, it does happen, but you can't just hold fast to the things that you think of when you think of working, right? Oh, I want a entry-level job. I want a remote coding job. If you put too many demands out there, you're going to miss out on a lot. And you're going to end up like that whole chorus of people who can't find a job and are telling everybody, oh, it's too hard. It's too hard. It is difficult, but you just need to put in a little bit of effort. All right. And when you set yourself up for success by doing the things that I've been advising, it makes it a lot easier to get in because this is how I did it. All right. So that being said, like I said, the difference between a temp agency and a recruiter, you'll see a lot of recruiters on LinkedIn. They have, big companies and things like that. I don't want to mention any of them. But let me tell you something about recruiters, because they say, oh, well, we are recruiting for this big company and that kind of thing. Recruiters are headhunters. They are looking for specific criteria because that's what their client is looking for. And they get commission for all the people who fit these parameters, right? And so they're not going to waste their time on somebody who has no experience, who's brand new and that kind of thing. So you don't want to waste your time with recruiters. Even me, that I'm an experienced medical coder, I still will not mess around with recruiters because, again, they are headhunters. They get commission for getting you with that company. So don't waste your time with recruiter companies, all right? Because again, they're a waste of time for brand new medical coders, okay? So that's something that you got to watch out for. Now, your job is to apply at hospitals, urgent care centers, nursing homes, dialysis centers, anywhere that they're going to hire medical coders, insurance companies. That's where you want to apply. Apply with those folks. Apply with big companies, right? Like hospitals and things like that, because then you're going to have more access to benefits and things. And it's not going to be like if you're trying to work at a private doctor's office where the spouse is already the billing manager and that kind of thing, and they pretty much have their own ways set up, and they don't usually, it doesn't work too well sometimes with brand new medical coders in that situation. So that's just my advice anyway. Now, I don't know every place in the world, and sometimes people are different, but from what I have heard and what I have learned from other people, that the best place for brand new coders is at like hospitals. And hospitals do outpatient medical coding, so don't automatically associate a hospital with inpatient coding. They also do outpatient coding because they have outpatient clinics in the hospital. They also do professional fee coding or pro fee coding, all right, in the hospitals. Now, professional fee coding, that's when the patient is staying in the hospital in a bed, and the provider from an outpatient clinic has to go up and visit them because their specialty, and usually that patient is admitted under a different service, so that outpatient provider's coming in as just like to take care of something else that the patient needs as well. So that's their professional fee coding, and that falls under outpatient rules. So this is something else that you got to know out there. Also know this. Medical coding positions are listed under different names. Now, I'm going to leave some of my past episodes about alternative jobs for medical coders in the description box below. Check them out and see, and so that way you can start applying for those different titles as well, and just get it out there. You know, get all of your information out there so that way you can try to get your first job. Now, when you come in with a lot of demands, that also hinders your ability to be able to get in. Sometimes people will tell me, well, Blue, I want to work at home because I want to spend time with my kids, or, you know, my kids are little and I don't have childcare and that kind of thing. If that is your motivation for working at home, right? That is your motivation for working at home. That's fine. But know this, when it comes to medical coding, you have to be able to concentrate. Now, if you say to me, well, Blue, I can concentrate with my kids in the house. Okay, you can concentrate with your kids in the house, great. But you don't need to tell the employer that. If they ask you, why do you want to work at home remotely? You do not immediately go into, well, my kids are at home, or I've got a sick relative, or, you know, whatever, because then it just seems like too much drama. You need to be about the company, right? Or make it like you are about the company, because obviously you want to get in. That is the goal. But you don't want them to be distracted by, well, I don't know, this candidate's got a lot of kids at home, and I don't know if they're going to be able to concentrate at work, you know, doing their work at home. And this is their first time working at home. You need to focus on, why do you make a good candidate working at home? Well, I am able to concentrate in my own familiar surroundings. I do have an area that is private, and that way I don't have any chance for any sort of HIPAA violations. So if that's the case, right, guys, just make it okay, this is the reason why I want to do this. And don't make it about, oh, you need to have all of the story about your kids and your spouse and everything else, because they don't need to know. The employer does not need to know all that. They need to know about you and your skills and what can you do for them. They don't need to know about your family life. They don't need to know about anything else like that. You have to keep things on a need to know basis. Do they need to know this? No, they do not. And while you may be proud of your kids and, you know, you want to show them off to the world, that's fine, but wait until you get into the workforce before you start doing that. Because if you start doing that right out of the gate, again, you may or may not be able to get in, because they are looking at you as a candidate as a whole. You know, is this person going to be diligent with us? Are they always going to have, oh, my kid is sick and I need to do this and I need to leave here and I need to leave there? Medical coders, the majority of them are women, right? Women dominate this industry. However, I will say this, for those mothers that are saying, well, you know, my kids are little and I just don't know if my employer will work with me, you never know. People are different. And the majority of medical coders are mothers, right? Not all, but the majority are. So they are going to know what it's like to be a mother. So if you're thinking that it's an excuse, it's not really an excuse, because they've all been working mothers themselves. When I got here, now I have no children, okay? But when I got here, everybody's kids were little. I mean, little. Like some were 2 and 3, and some were 5 and 6, and, you know, they were just like kind of like teeter-tottering around. And now they're all grown, and they're all like, you know, out of high school, and they're, you know, starting their own lives. So I'm like, when did this happen? But they made it work. Even though they had little kids, they still made it work. So again, if you're thinking that, oh, I can't get into this because, you know, my kids, they made it work, and I'm sure that if you plan it out, you can make it work as well. So that's my advice anyway. But guys, we need to take off these blinders of, only applying for entry-level positions, because that's not the way to get in. All right. And the other thing is, do not commiserate with other people, like on Facebook and even on LinkedIn. All right. Everything you do, particularly on LinkedIn, is going to be watched by other people in the industry. I've had to block a few people who have been brand new medical coders. They follow the show, and they were just complaining and complaining and complaining and making themselves look really bad. Well, you know, I always say on my show, don't complain on LinkedIn, because again, this is the mecca for all these employers and everything. You're going to get a reputation. There was one that was so terrible. When I talked about it before, I didn't mention a name, but a lot of the audience already knew who I was talking about, because they had heard this same person complaining. Okay? So you don't ever want to get yourself in a situation like this. If you can't find a job, you keep a positive attitude and you keep looking out there. And look at your resume. Look what you're sending out. And look at your attitude. And when you are applying and you're sending out your cover letter, it needs to be specific to the place that you are applying to. It needs to have the specific job title. It needs to have anything that's relatable to that position in that facility, all right, in your cover letter. And so you may have to update it every single time. And same thing with your resume. You may have to update it, because if you're applying for a medical billing position, and then maybe you're applying for a medical coding position, and then maybe you're applying for a health information tech, because sometimes they're listed as that and it's a medical coder. You may have to update that every single time on your resume. And please don't complain to me, oh, Blue, I have to do that every time. We all had to do that. Do you want to do this or not? Right? And if you do, this is just something that you have to do, and don't complain about it, guys. This is part of it. This is paying your dues to get in, because once you're in, then you're in. You're home free. Because you start getting that experience, then you can move on to other places, other things that you want to do. But again, when you get in, it cannot be all about you. When you are thinking that in the beginning, it's going to lead you nowhere. But when you are thinking, okay, what are my skills going to be able to do for this facility that I can take with me to another place? When you have that growth-minded attitude, that's what's going to get you out there. That's what's going to get you the job. But if you insist on seeing the entry-level position, or seeing that you want somebody to train you, and telling people, I need my hand held, you are going to be waiting for a long time, my friends. A long time. So don't do it. You got to get yourself strong, and you've got to get yourself out there. And the best way to get yourself strong is to continue to practice with your books. Continue to practice with your coding workbooks. And when you have your coding books, you got to make sure you're still reading your coding guidelines. I hope you're still following that challenge. I reissued the ICD-10-CM and ICD-10-CM coding guidelines challenge the beginning of this month again. I refired it because a lot of people were like, well, I only read it once and I couldn't keep up with reading it every day, so I just gave up. Okay, if this is you, you need to go back at it again, and you need to try to get disciplined, because those are the questions that those employers are going to ask. Okay, well, do you know this about the guidelines, this about the guidelines, what about this? And if you can explain to them and tell them, oh yes, well, I know where to find that, or yes, it's this and this and this, they're going to be more impressed with you. All right, because it's about that. It's about, okay, well, they know. Let's let them in. Let's go ahead and bring them on in. But you can't give up. You can't complain. You can't keep on like, oh, I can't do this. I can't. Yes, you can. Yes, you can. You absolutely can. But you have to start believing in yourself, guys, because no one else is going to believe in you, and no one else is going to hold your hand. That's just my advice anyway. Cool. So I'm going to wrap this one up. Thank you guys so much for joining me. But stick with it, guys, and you will make it. All right? We all did. The ones that stayed in, got in, they're in. All right? So I'm going to see y'all in the next episode. Like, subscribe, and share. Bye.